Welcome to the next episode of the Building a Bulletproof Backs podcast. Joining me today, I have my longtime friend, Riccardo Galeotti from the Body Lab in Canberra. And Riccardo,
Hello.
I was actually reading your Facebook page before we jumped on, and I love that you've put super keen about the human body in so many ways. And honestly, I think that's what unites us is we like exploring the human body. Probably I go a bit more into the emotional, mental stuff, but I think you come at it from the Eastern medicine, the mechanics. And we met doing an AIM course all those years ago. And yeah, I thought you'd be a really good person to talk to and have this back pain conversation with. But before we jump in, would you like to introduce yourself to the listeners and just give them a bit of a background about the science, sort of the tools and the sciences that you bring to the table?
Thank you very much. Hi, everyone. I'm Riccardo. I've been an acupuncturist for nearly 19 years now. Graduated in the UK, and spent a long time doing sort of TCM, traditional Chinese medicine, and probably felt unsatisfied with the level of training that I got and moved more into classical acupuncture and classical Chinese medicine, which looks at the broad depth of Chinese medicine way back to 1500 years ago when it was established, and finding out how it actually moves through the system, what your body is doing. And I think Chinese medicine in general is applied philosophy. So they're looking at nature, they're looking how things are moving, how animals are eating, what the interaction with the environment is, and studying that over a very long period of time and pulling out these glorious bits of information and using that to be applied in their own system. So the Chinese society back in the day, classically, is all about how the body moves. They talk about the five elements, they talk about qi, blood, and so forth, but it's about how you're interacting with your environment and vice versa, and what you can change within that will change basically something without. And that's what I see, how Chinese medicine, the glory parts of it, is always going within. What can you change within yourself in a way that represents what's happening on the outside of society, basically, which is a
Which,
nice way of looking
yeah, it's a
at.
beautiful way of looking at it. And I guess it's different to I guess, the solutions many people seek, which is to have something done to them rather than taking responsibility for perhaps reflecting on something they're doing that might be perpetuating the cycle. So when you work with people in back pain, what sort of, how do you approach it? Or how would you like to approach it in an ideal world?
That's a great question. So we're looking at Chinese medicine. So it's very broad, as I said. So classically, there are six channel systems to treat someone. So six channel systems, and there's in that about 62 channels that you can use in terms of Chinese medicine or acupuncture to treat someone. So we can't just say back pain is related to musculoskeletal pain or some accident. We're looking at the broad spectrum of channels. And what I do is look and see, well, is it a surface issue? Is it the continuous region? So there are several regions in the body, channel systems, that each one treat the body differently. So for
Hmm.
example, is it on the exterior channel system, the continuous regions, or the sinew channels? So that's to deal with more muscle-based treatments. And they're traditionally every day for 10 days. So we're looking at the external terrain of the body. And then if this is not treated properly or the pathology goes deeper inside, then everyone knows the primary channels, those 12 channels that everyone sees on the acupuncture parts behind me. It's all those meridians that you see. And they deal with pathology that's moved in and out of the body where it's going slightly deeper into the system. Or if it's an emotional based problem, then we use the low channels to treat pathology. Again, a deeper subset past the primary channels that involve now more blood related issues. And the Chinese believe that blood houses the shen or houses the emotions. So we can use that if it's a sort of emotional based pathology that someone has. Now, if it's chronic and the body is using its resources to keep this pathology down, then they use the divergent channels, which is a link between the bones and the skin. So we're looking at more long-term pathology that might sort of affect the bones. And if it keeps on going longer, so there's progression theory of when disease comes in and you're using your resources, whether it's like qi, sort of a version of breath and oxygen in the system, or blood or fluids. So you're always using a resource to keep pathology out of your system. So if you're deficient in, for example, oxygen, you're not breathing enough, or the transfer of oxygen is not going through your system, then we can say that your qi is deficient. If you're using blood, if you're losing a lot of blood, or you can't manufacture blood, then the blood network potentially, or the emotional side, is being taxed to keep whatever is outside from getting in. I hope that makes sense. So I look at what resources are you using all the time in your body to keep your body always going, whether it's qi, blood, fluid meaning hormones, so to speak, or fluid, other fluids in the system, or are your body breaking down calcium, which is bone in the body, to service inflammation in the body? So we're looking at the body and giving us clues about what you're using to maintain what we call latency in Chinese medicine, keeping pathology at bay all the time. And this always happens. We always have disease in our system, but our body's healthy enough in general to get rid of all those. But if you're overworked, if you're stressed, if you're using your body in an appropriate way, one of these levels will be affected. And then we want to say, what can we do to help people, in particular, let's say back pain? Is it an emotional component? Do I need to build back my blood to help with my emotions? That's what we would say. So we'll then look at the stomach and spleen, for example, as a diet therapy to increase the function of those two organs to manufacture more blood. And that means that, you know, you can look at then emotionally, if I build back the blood and have an idea of what your workbook looks at, getting your emotions back by using your breath, because qi and blood creates this idea of energy in our system, then we can sort of build back that process to be more harmonious with what we're trying to do.
And
so that's my
when someone comes in to see you, I guess they have no frame of reference that this is what you do. I guess they're thinking, I hope you stick some needles some places that actually help me walk out in less pain. How do you
we
go
have
about
to diagnose.
how do you go
Yeah.
about having that conversation with people?
Well, then we look at our diagnosis tools. So we can look at the tongue to see what the diagnosis of your digestion is doing. Do you have a pale tongue? Do you have a red tongue? Is it scalloped? So it tells us really quickly what's happening internally. And then we can say, okay, based on the tongue, I'm imagining you're losing these type of resources. You're maintaining your body through this. Let me just check your pulse to see at the moment what your nervous system's doing, how the blood is moving through, what the different layers of your pulse is doing to reflect what your nervous system's doing. And then we have a discussion about what your exercise like, what your sleep is like, how are you emotionally, to get this overall picture of, well, your back pain may be related to you're not eating well, you might be someone's always on your back, for example, so you emotionally have other things going on. So then we have the picture like, well, I may need to build something up inside you, because acupuncture is all about moving, right? It's a system that moves qi, predominantly in blood, around the system. So we're using the acupuncture points to move things around, and you can look at it like a moving ions through the body, moving potassium and chloride and magnesium through the system using acupuncture points. So then we're looking at the acupuncture is moving these electrons through the cells at a quicker rate than your body would have done previously. So that's a nice way of looking at what acupuncture does. So instead of just needling the back, which may be painful, yes, how can I move things through the back to help with that pain? Are they deficient in blood? So I move more blood through, or chi's deficient, or chi's insufficient, or chi's stagnating, or blood stagnating. So we're looking at the clues through the tongue, through their pulse, through what they're talking about, through the movements that they miss, to either bring back that area, more blood or more chi, or taking that area away to make less congestion, so to speak, for more things to pass through.
And that highlights the difference between trigger point therapy or dry needling, which has become quite a popular therapeutic intervention by physios, particularly, and true acupuncture, which is about, a whole system integration. What are your thoughts on I guess, the effectiveness or the impact that needling some hot spots around a sore back can offer versus treating the whole system that acupuncture can offer?
It's a very limited scope, isn't it? I think the book was Travail, wasn't it? Which is the trigger point therapy, which really brought this idea of putting a needle here that will release this area of muscle going forward,
Mhm.
which I think there's merits to it. Don't get me wrong, but I think if I had a choice between a trigger point or an acupuncture point, I would go with the acupuncture point,
Mhm.
knowing that it's not releasing the muscle that people want, because people sometimes want some action, don't they? They want a muscle to spasm. They want to feel like you've done something. Where, again, underneath the terrain of the muscle, underneath the terrain of the acupuncture point or trigger point, what is the human needing in that session to help them? So if someone is deficient in chi, right, so they're tired, they're run down, and I stimulate a trigger point to the point where it spasms, you're using that chi for that area. You're making that person more tired. And if they get more tired, again, they're using more resources to feed that issue they have and create more pathology, I think, in the long run.
Mm.
So I think we have to take into account the needling is doing an action. If your intention is to make a muscle spasm, great. They're creating what we all call a complete yang of a muscle, complete spasm, for then it to go into a yin state, which is total relaxation. But we need to understand why that person is in that state first without just putting a needle in, understand the
100%.
foundation behind that individual, because everyone's different. I think that's the hard part with Chinese medicine. There is no standardized person out there. You are individualized in terms of your upbringing, your emotional capacity, your state in the world. And for me to say, I'm just going to put a needle in here that does a trigger point, that does this action because of the book says you're standardized, is, I think, robbing the individual of a comprehensive treatment, as opposed to just a immediate relief of one small area.
Yeah, and I see that so much in the back pain space about exercise sheets for disc injury versus exercise stabilization exercises for hypermobility. And, there's this, and I get it, there's this natural need to try and simplify rehab for practitioners as much as for the client, that we want to recipe it. We want to make it as simple as that because it's simpler for all involved. But again, in my experience, two people can walk in with the same diagnosis, like an L5S1 disc injury, but what's triggered it is just a kaleidoscope of different colors and influences, which means if I'm truly trying to get to what triggered the injury, not just treat the injury, my level of assessing someone's thoughts, beliefs, emotions, movement patterns has to be diverse and robust to really figure out for that person what caused this particular zone to become stressed and implode, because that then directs how I manage it. And
Absolutely.
that's, I guess, the difference that we see between short-term band-aid solutions versus true work that will get someone a much longer lasting outcome.
Do you find that achievable in terms of most of your clients would like um, to find out the truth in
It's a
what
good
we do?
It's a good conversation and it's a very clinically practical one, isn't it? Because if you're in pain and you've taken an hour off work because you're just in absolute agony and you just want a solution to get back to work because you feel you have, mums with kids, they just don't feel like they can stop. There's times in life I think we just no judgment. I think we just have to get some relief.
Mm.
I would like to think down track. when there's less pressure and there's more time and space to actually deal with the root issue. I think that's a luxury. And I always much rather prefer to work with the patient and the system from that space. In fact, I've actually stopped doing short-term relief stuff. It just doesn't feel integrous to who I am anymore. And I sometimes feel like if I give that, I'm more an advocate for the body, I guess, than the person in the body. I kind of feel like I'm doing the body a disservice by patching it up so I can go back into battle again. Um, that feels for me wrong, but I know that's not everybody. So I'm very open to people in whatever moment they're in whatever space they're in, have choice, and that's true freedom. And I love that as practitioners, we're at all different levels of how we want to operate and practice. But yeah, I personally have got to that point where I like a bit like I think I feel you might be, where it feels like a personal insult to kind of just perpetuate short-term fixes.
Well, I don't think my daughter would like this, but she had some back pain on the weekend. She woke me up at like God knows 3 o'clock in the morning, saying I've got period pain. And I'm like, okay, so I didn't click. I think she'd had cramps, but it was actually period pain. And I said to her, I said, where is it coming from? What are you going to do about it? What does it mean to you? All these questions to invite her to go in and say, well, is my period not going well? Is it a blood issue? Is it chi? All these things. Because she wanted to get down to the bottom of it because some of her friends are on the pill, for example, and trying to get an easier response because she's in pain. And then
Mhm.
she took pain and she's like, it's amazing how quickly it went. But it made me feel bad because I had no idea what the result was going to be. Yes, the pain went away, but why was it in the first place?
Mm.
And she was aware of the fact that she did not know, it went away, but why was it there? And what can I do to find out if it's going to come back? And I
Mm.
had this great conversation about this is your chance to explore in your body how you can try to mediate that in a
Mm.
way that it's useful for you to feel what's happening in your body without just taking medication.
Mm.
Obviously, she knows views about medication in general. I don't take anything myself, and she's got the choice of doing that. She's 14 to do whatever she wants with her body.
Mm.
But to have this response, have this discussion about what is best for her, to think about what you put into your system without
Mm.
knowing effect or why the cramp there in the first place. Obviously,
Mm. Yeah, and
kind of interesting.
sometimes learning to coexist with pain early in life is not a bad idea, is it? Like this idea that we should never be in pain physically is flawed. I think the body has pains, and to fear them and to want to distract and perceive that every time something hurts, something's wrong is, just that's a nice conversation to have early on. I've got two different kids with two different approaches. I have the yes, the 16-year-old daughter who is very big at wanting, actually, she's got an amazingly high pain threshold, I will say, uh, and just seems to be able to cope and get on with pain. It just floors me. And I've got a son who's very anti any medication of any kind. So it's really interesting, isn't it? Those choices that form early in life. And yeah, circling back though, I think pain, if it's come once and it feels short term and it feels new, I get people just want to patch it. But I think if you're in a cycle, and I think if it's the same pain and it keeps knocking on your door every few months and it keeps coming back, I think it's inviting you to explore more. And I'd like to think that most people, when they can, do that, but perhaps not. Perhaps what I see then is that the body escalates, the body intensifies, and the body demands eventually that you do pay it attention. And I think we could circumnavigate a lot of that if people were encouraged to meet their body with its signals a bit earlier in that cycle.
The hard one, though, isn't it? I think people would need to do what they need to do and think, I'll put it off until I absolutely can't cope with it,
Mm.
basically. So,
Why do you think they do
yeah,
that?
I think it's convenience, isn't it? We've been instructed in a way to think if I've got pain, just take something or go away. You don't have to worry about it.
Mm.
I'm the opposite. I wouldn't say I love pain, but I love the sensation of if I've got knee pain, I get knee pain often. I think, oh, okay, that's interesting. And then I just let it go and just see where it goes. For example, does it go to my back? Does it go to my shoulders? And if I get rid of the knee pain in certain activities or movements or food or whatever that is, does that settle the other areas that potentially I'm in discomfort as well? So just find out if an area is not comfortable, does that move throughout the system? If I change one, does it release the other? And have a game with myself. Um, Obviously not for too long, but
Mm.
enough to study and being discomfort of being in pain, whether it's
Sounds
knee pain.
sounds like you get curious about it and you start playing, which is a very cool way to be with pain, I think. It's an invitation, I think, to get to know ourselves better. And yeah, that's the invitation. But then I get also that life can just be coming at you from every level, and that's the last thing you want to, you're just not in the space, or you don't have the capacity or the mental energy to even go there. So time and place is, I guess, where I've come to eventually. So when I say bulletproof back, what does that mean for you? What comes up?
Embracing your back, making sure that your foundation is secure and you know where it is, you know where it's at, you know what what you can do to make sure that it is stable and solid to do anything you need to do.
Mm,
So,
nice. Nice.
I think your back is that, I think Chinese say, what's on your back? What is always on your back giving you pressure down? And you need to uncover what's there always on your mind. And it goes back to that channel system. So if you think of an activity, if you think of 100 activities, your bladder channel, and the bladder channel starts from your eyes, goes all the way up, and separates in this back tube, and it goes down all your back, all the way down your sacrum to your fifth toe. And it's always active, always. So
Hmm.
the more things you have in your mind, the more things you think about that bladder system, that movement, because you need the bladder channel to sort of move and activate. So it's always active. So I think I love your course that you do. The Bulletproof Back is all about relaxing the mind, clearing the mind. The more you clear your mind, that bladder channel is always then relaxed. It's always free to unblock itself from motion and activity all the time. Because the
Mm,
moment you think something, you have to activate those back muscles
mm.
always.
And
So
it's just that integration, isn't it? Like we learn body, mind is somewhere in the brain, emotions, well, I don't even know where people think they hang out, but they do hang out. And I think what we're learning is they hang out in our embodied fascial network. Um, but this segmentation of who we are into parts and segments is, I think, what limits us so much when it comes to being curious about the body. But if we're talking to someone right now in back pain, what are your top three tips you'd pass on with all the knowledge that you have from all the different disciplines?
yeah, I think the big one for me is movement. You know that. So I think movement is the key. Um, hydration in terms of food wise is the second big thing,
Hmm.
and understanding what you're lacking in your life, whether that's people, food, engagement, meditation, something like that, that you think I need more of that in my life
Hmm.
to so movement can be anything. That can be sitting, that can be being still without movement, it can be Tai Chi, it can be Qigong, it can be walking, swimming, whatever thing that you can do to relax your mind in a meditative state is wonderful. Because I tell there's a lot of people that have to go places. I went to Bali, had a fantastic holiday, I did a yoga retreat, and I'm like, great, perfect. What was in that yoga retreat that made you feel wonderful? Bring it back and pretend that you're there in your mind every day. Because
Hmm.
you don't need to go somewhere to have that. You can just picture that in your mind. And in theory, the more you do, the more your body then gets into that position and relaxes. I
Mm.
think that that's what meditation is. If you're bringing that aspect of what you love doing,
Mhm.
whether it's walk, creative, or whatever that is, into your everyday world. So then when you do think about it, your whole body relaxes.
I
Um,
like it.
Wonderful. And food to me is healing, nutrition,
Hmm.
able to food and eat food that heals the body, which is a wonderful way. And that's my passion is diet, in terms of Chinese way of looking at diet, which is another issue in itself, and talking about that. Um, yeah, and then just being with what you're lacking in life. I think is the bigger one,
So
in
add the
terms of
missing part, I guess, which is that whole AIM philosophy, isn't it? Find out what's missing and put it back in the system. Mm.
correct
But missing, in, it could be, like you're saying, it could be fun, pleasure,
fun,
uh,
pleasure, emotional contact,
stillness.
emotional anything. Yeah,
Yeah.
that's right. I think we go at a far pace all the time with our life. And I
Mm.
think we rarely sit down and look at the wonderful things inside of us and what we need to function,
Hmm.
and what we too much of that we need to let go of.
Yeah.
That are of balance and harmony that are going forward, the homeostasis that you have in your body. And that's all aspects, physical, mental, emotional,
Mm.
there's no separation. So you're looking at each box and working out which one has too much, which one has not enough, and then filling it up in the way that best fits your purpose to get that, harmonious, basically.
Yeah. Simple stuff works, doesn't it? I think we overcomplexify it a lot. And I like that one of just doing almost like a little bit of a lifestyle audit and go, what's missing? I've got plenty of that. I've got plenty of that. What's missing? And then it's a bit like an ingredient. It balances the food, it balances the everything. When it comes into balance, everything in our systems tend to work better. So that's a really cool, nice, simple one, I think. Good. So if people want to access you, what are you offering? Where can they find you?
Just
I,
the body
I
lab,
love, can I just say I'm
bodylab.au.
loving, can I just say I'm loving the videos on the Body Lab?
Thank you. I put so much effort into those videos and trying to communicate easy things you can do to help yourself, particularly move better. I think walking is such a fundamental thing that we do, and all movement is based on how we walk. So if we can move better, we'll live longer and be happier.
Mm.
So I'm all about getting people to move, and
And
getting
move
their body
well, move well,
move.
moving well. Yeah.
And then the other side of things is acupuncture that I use internally, basically getting the systems working better. So when you do walk, you're on track, basically.
Yeah.
So
I see from your perspective that the walking is just that nice chi mobilization, isn't it? Like it's stopping a lot of stagnation if we move in all spaces within our body, we're allowing chi to flow into all spaces. But I guess if we're moving poorly and we're not moving from all that's possible to move from, then even if we're walking, we're still probably experiencing stagnation in some spots because they're not being
yeah,
accessed.
I'll tell you a great story. I got bitten by a spider. I don't know which one it was, and my leg swelled up immensely. And I wanted to see what happened. And I moved my leg unbelievably, like so much. And the amount of no tissue damage, but it would not move. I had to
Wow.
cut my leg, increase the movement through to get any motion. So the amount of motion you need in your legs to increase that blood flow, lymphatic drainage is amazing, for the system to feel. So any motion you can get in your legs is beneficial for the whole system, and
Yeah.
particularly circulation and fluid motion. So encouraged for sure.
Mm.
And then obviously the arms in terms of Chinese is caressing the heart. So it's looking at blood flow for the whole system. The arms are a different beast, in terms of motion around the upper channels.
Mm.
But the legs are obviously easy to work with because you're in contact with the ground. So it's nice. And everyone walks. No one walks on their hands, predominantly. It's easier.
Good point. Very good point. All right, my friend, that's great. We'll put some links to your website and all the rest of it in the notes. And yeah, thanks for those thoughts. I like picking people's brains that look at the body in different ways. So thanks for your time today. And it's been good catching up. The things we have to do to get to catch up.
I know, I know. Let's do it again soon.
Yeah,
Thanks,
and
everyone.
keep the videos coming. They're great. Especially if you
Perfect.
want to
Thank
learn
you.
about foot mechanics and lower limb biomechanics people. Go
Come
to,
to my
pardon?
come to my workshops. I'll be hitting Perth in sometime in late in the year. So it'd be nice to catch up in person as well if anyone
Oh,
wants to
for
catch up.
sure. I didn't know that. Great. So let us know about that. When are you coming to Perth and when are you doing your workshops?
Hopefully in September, I think it is. So it'll be 2-day workshop somewhere in Perth. So
Nice.
if you're interested about feet mechanics and how that works,
Love it.
come on.
Love
Wonderful.
it. I'd love to join and hang out. I'll bring my foot, what do you call it?
Model.
Model. Yes. It's got dusty lately, but I'll pull it out again and resurrect it. Yeah.
Clean it. Get it working.
All right, Ricardo. Thank you for your time.
Pleasure. Ciao.
Bye.